At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Foot Function and Skeletal Health on Wednesday, January 22nd at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to the Sunday before an amazing holiday weekend. Why is it so amazing? Why is it so great? Well, it's one of those years that Hanukkah and Christmas start together. Christmas is Wednesday, the 25th, and the first day of Hanukkah is Wednesday, the 25th. Amazing, right? Well, that's what makes it very special and loving and peaceful and so forth. And make sure that you understand that Christmas and Hanukkah are a time of peace and love and sharing and so forth, particularly in my world. You know, the first generation Sicilian here, that we have our normal, small gathering of hordes of people. Well, that's what I grew up with, and we understood what really it was all about. It wasn't just a gathering of people, but it was a sharing of the initiation of so many things, particularly the birth of our Creator. But anyway, I want to wish all of you a very blessed, happy holiday season, a Merry Christmas, a Happy Hanukkah, and hopefully that you'll enjoy it. It was really sad in my office the other day. There was a doctor who I treat that comes in to see me, drives in a couple hours, and about once every 6 weeks, and she's way out in the hills, West Virginia. And I know this person well, have a lot of respect for her capacity. She leans definitely the right side of the spectrum politically, and particularly as it comes to, if you will, freedom of choice in your health care. And she was sitting there, and I said, "Hey, girl, what's up?" And she said, "Nothing, I'm fine." I said, "No, you're not. What's going on?" So I finally got her to tell me that her family has basically ostracized her and disassociated her from the holiday gatherings because she dared vote conservative. And I just looked at her and I said, "You got to be kidding, really? Tell me that's not the truth." But we all know that has happened to so many of us, and it's unfortunate. Look, here, at the end of the day, it doesn't make any difference which way you lean, right or left. I grew up in a world in this country, decades ago when I was young, that I was taught that everybody, each one of us, have different opinions, belief systems, religions, philosophies. We come from different places around the world, and it's okay to have that. That's what makes us grow as a society. But to disenfranchise, disassociate, push away, hate because of those differences, that's where the error comes in. So, as we're coming in next week, I'm going to talk to you a little bit about setting standards and goals and commitments for yourself as we go into the new year. But what I want you to really understand is that what better time of the year to commit to loving people. Doesn't mean you have to agree with them. Doesn't mean you have to embrace and applaud and perpetuate their belief as it was something that's in opposition to yours, but allow them the grace, the love to be able to have that ownership of it, and then a conversation. Years ago, the holiday season, when I was growing up, it was very predictable that my family, being very Sicilian, and the 30, 40 people that would gather at my mother's and my grandmother's house and so forth, there was always a fight, starting from Thanksgiving on. And it was a row. It was over the top. But you know what happened? They'd leave, and then the next weekend they'd get together, and everybody was hugging and kissing and so forth. And it was okay. They fought, well, at high level decibels, which was typical of, our culture, but they let it go. They didn't perpetuate it. They didn't continue it. And it was okay. They just kind of let people find out along the path what was right for them. So I encourage you to try to make that happen, and as you engage with other people. It's okay, if people believe one thing. It's not okay for you to hate them and disassociate them from your family, your loving relationships because of that. Now, having said that, let's get in the program. And I hope it's a great, great, great week for you. Hey, have you finished your shopping? All the things that you want to buy for little people. Well, I did most of it. I got two little things I got to go do probably today after the program's over. I'm going to go take off and make that happen. However, having said that, my friends, what are we talking about? Well, we're going to talk about something that you probably hadn't thought about. And what's that? That's relationship of your pedal base called your feet and foot pain. It's going to kind of a lead into a program that we're doing in-house coming up in January, our first in-house program of the year. And it's your feet and your skeletal system. So your feet is the basis of everything that's above it, right? So it's your spine, it's your hips, your neck, your head. And if your feet aren't working the way it's supposed to be, there's many things that are going to be in error. And that error could be the perception of pain. It can be migraine headaches, which we're going to touch upon today. And it could be that you have an ED, erectile dysfunction problem, because your feet are often is causing your low back to collapse. And if that low back is not working the way it's supposed to, the nerves that go to the genital urinary system, what do I mean by that? I mean the ovaries and the uterus and the scrotum and so forth are going to be irritated enough that it ain't going to work when you want it to work. So it's really important that we understand how much the feet have to play. As we get into the second part of the program, meaning our live stream, and by the way, how you find that is simply go to drtomroselle.com. That's drtomroselle.com. Or if you're following us on any of these social media sites, you will be told when the program is going to hit. But we're going to talk a little bit more about that and the differentiations, but simply understand that your feet have tremendous amount of reflexes, acupuncture reflexes. They have the basis of how everything lines up on top of it. And, there's points that even in Chinese medicine say, if you have a migraine, go to these points. And, interestingly enough, they have to do with liver function and kidney function, and they have to do with gallbladder and so forth. All the areas that get irritated, inflamed. Now, they can be inflamed and irritated simply because of the fact that you haven't been doing a good job with your dietary patterns. It could be because you've been going out and eating all the junk, right? The sugars, the sodas, the coffee, the fast foods, the fried foods, all the stuff that you shouldn't have in your system. And particularly this time of the year, you wonder why your head hurts, and you're taking all the Excedrin and all those things, which is not doing anything except making things worse over a period of time. But when we know that the feet have so many different reflexes, they're the support base for everything that's above it, wouldn't it make sense that if you have a headache, if you have a migraine, if you have neck and shoulder pain or any other pain, that might be a place that you want to look at first? I know that over 4 decades of practice, that's an area that we check out with every patient that comes in that has, when I teach doctors, I said, watch the patient walk. What do you see? Look at the feet first. Look at how the knees are moving in relationship because the foot's not hitting the way it's supposed to. And then we start picking it apart. For you to bend your neck forward, your chin on your chest, that's called neck flexion, right? And when you go backwards, it's called neck extension. Did you know that your feet are primarily contributory to your ability to do that the right way? So when we have a patient, we're examining them, we have them on the table, they're face up. We test the neck muscles by pushing down on the head with their hands kind of out to the side, with their palms up. And the muscle weakens or inhibits, as we like to say technically. And then I said, all right, pull your toes without bending your leg towards your face. And then when we test the head flexors again or the neck flexors again, guess what happens? They're strong. They're fully facilitated. Wow, right? Good deal. So that all by itself is an indicator. It's a a finger pointing that says, maybe we better look at the feet if something's not going well with the head, neck, and shoulders. As we get into the program over the next few weeks, we're going to talk about those relationships. But on the 22nd of January at the Roselle Center for Healing, well, at 6 p.m., our normal time, Dr. Harlan Browning, the professor, he and I are going to be entertaining you with a lot of different pieces of the puzzle. We're going to actually show you. When it comes to the feet and the neck and head and shoulders, Dr. Browning is a master. Many of you know it. He's just incredible when he's able to pick things out. So we're going to make that happen for you. So make sure you register. As we fill up very, very rapidly. And the last one that we had about a week ago, place was packed. And it was actually fortunate that not everybody that signed came because of the weather. We had some really ugly weather, but we were still packed house. And please join us. I promise you, as always, you're going to walk away with all kinds of interesting tidbits, if you will, if nothing more. But let's talk about foot pain and headaches as it relates to, what happens. Think about this. When you're walking around, does your head hurt more than when you're not walking around? Does it seem to exacerbate? Is it difficult for you to bend your head forward or turn your head one way or the other? But it doesn't feel that bad when you're seated or when you're lying down. It may not be because you're taking, a relaxed moment. It could simply be because of the fact that your feet are the contributory mechanism to all this silliness that's causing you to go, ouch, right? So we have to take a look at everything within the system. But in this situation, we have to make sure that we're accurate, because if we fix your feet and we fix all the muscles that are connected to the feet, and we fix all the acupuncture channels that are either beginning or ending in your feet, then guess what happens? Your headaches go away and they don't come back. So we have to make sure that, it's just not take this for that type of attitude. Unfortunately, our society is loaded with that. If you go into a traditional medical facility these days, we can fix this by giving you this drug, and it just kind of destroys everything else in your body. But we want to, check it out. We want to check out the tenderness, the tension, and so forth. There's a patient that walked in. I'm going back about 7-8 months ago, and this guy was worked construction for a lot of years. He's actually owner of a fairly sizable construction company, and he was telling me that he loves to work with the tools, but he can't be on his feet too long, so he's just managing. I said, "What's going on with your feet?" It's not what he came in for. And he said, "It just hurts. I've tried every shoe in the world. I put all kinds of orthotics in it." And he said, a little bit of relief, but he said, not lasting. I don't have the ability to keep it stable. So I said, do me a favor, take off your shoes. So I looked at, his feet, and I said, man, how do you walk on those dogs? I said, they're ugly. He starts laughing. He says, thanks, doc. Don't tell me something that I already know. I said, no, seriously, from my point of view, you've got all kinds of things that are going on. Your arches are dropped. Your toes are kind of bending up and inward. You're developing that big old bunion. And I said, what is coming from is a couple of different areas. And so the short end of a long story is that we tested, and his liver was involved. What's that got to do with your feet? Well, the big toe is the beginning channel of the acupuncture for the liver. And then over on the other side, the fourth toe is the acupuncture channel for gallbladder. And I said, let's take a look at a couple things. And so we found that, in fact, it was inflamed. That constant irritation was allowing the arch to drop, but it wouldn't hold. That's why he couldn't get any relief by putting arches in, is because the liver was a mess. So we did some things that we normally would do, and we treated him. We adjusted him chiropractically. We did some acupuncture with him. And then I taped his feet. And I said, I'm not going to change your orthotics. We're just going to change, your gait temporarily by taping functionally. And I want to see what happens over 2-3 days. And I had him come back in. And he looked at me. He says, what did you do? I said, I positioned your body so it was going to do what it's supposed to do naturally. And I said, did you stay away from, the things I asked you to stay away from. And he said, yeah, I did. It was hard. I said, how's your head? How's your feet? He says, I haven't had a headache and my feet are fine. And I said, okay. I said, you ready to go? And he just looked at me and said, yeah, fine. He says, I put up with these things too long. But those are the kind of things we're going to go into in depth, over the next few weeks. I'm going to talk about all kinds of weird things that you wouldn't have thought about. But nevertheless, when your head hurts sharply when you're walking, that tells you something. When your headaches increase with any kind of movement, that's a problem. Now, obviously, everybody says, oh, I must have a tumor. Well, we're going to go to the statement I make all the time. When you hear hoofbeats, look for horses, not zebras. What does that mean? That means when you have a problem, look at the things that are the most common, not the cancers and the space-occupying tumors and all that stuff. Do they happen? Sure. But are they very rare? Yep. So you have to make sure that you understand, that it's just not a matter of running, tons of tests, which are going to run tens of thousands of dollars. Insurance companies don't like to pay those anyway, but the medical profession, the hospitals love to charge for them, because it puts money in their pocket. And in my opinion, way unnecessary when if you do a normal examination process that's very specific and intentional and finger pointing to what it is that you're trying to deal with. So as we get into your feet, if you will, and how it affects the ratio, understand that foot pain can cause headaches and migraines. And so, let's start with basics as we just kind of led into. Flat feet, fascia patterns, can be problematic, and they can contribute to this. Posture patterns that are very tight because of, what's happening in an overstrained situation. Bad gait patterns, they can cause radiating pains, and it starts with your feet. So when you're wearing, ladies, unfortunately, if you're getting in there and you're above 1.5 to 2 inch heel that's not compensated for, meaning you're on spikes, ultimately you're going to have headaches, you're going to have back pain, you're going to have all kinds of other things. Why? Because it throws your posture pattern off. It forces you forward. And then you extend backwards to compensate, and you're jamming everything, including your head, neck, shoulders, all the way through. And so migraines and flat feet, if you will, are totally, totally related. So there was an interesting study, and the arches develop, pretty quickly, usually by the time a child's 6 or 8, and we move up from that. But the problems that exist also, and you got to talk about them. Things like any injury to the ankles, any twist and turns of the ankles and throwing the gait pattern off. Now the muscles aren't firing the way they're supposed to. Diabetes. It just is, my friends, unfortunately. If you want to find out if you have a potential of diabetics, look at your legs from the knees down. And is the skin kind of tight? Is it kind of bluish compared to the other area? Light blue, doesn't have to be, starking, raving blue, but, just kind of a tinge to it. Does it look like you could touch the skin and it might break? Is it slightly swollen? It goes right down to the ankle, and then your toes get into the act as well. But if that's the case, your blood sugar is not, I don't care if you're on medication, you're not healthy. And you've got to change that if you have any prayer, number one, of saving your feet before they're going to be chop and cut, but more importantly, to get muscles to work that they're supposed to be working. So if you're too fat, if you got rheumatoid, that's your gut, they're going to destroy your feet because all those, remember what I said? Big toe, what is it? Liver function, starts at the inside of the toenail, your fourth one, and then you have your stomach meridian and all those things there. But the pedal base, the way that your body sits is the problem. And so as you're walking, if you've got bad arch and it wasn't like that when you were growing up, you got a problem. And we have to make sure that, you change a few things if you want your life back. So if we have flat feet because of whatever, if we have arches that are way too high, sometimes that can be a problem. if we're out walking, running, jogging without good support on our feet, you're going to break your body down. Are you on your feet all day long like I am when I see patients? You have to make sure that you're very supportive. Otherwise, not only your feet and your legs and your back, but you're going to get those headaches. They're going to be ugly. And so you have to really understand, and it's not just a matter of going take 2 aspirin and call me in the morning type of thing. So the inflammatory reaction can cause, and by the way, here's the other piece. Did you know that if you have socks on that are way too tight, can be a problem? The socks are not meant to be compressive, at a short level right around your ankles, right? Because it's going to stop the circulatory pattern, and that adds to the puzzle. We could spend the rest of the day getting into this. We don't have the time, but I'm going to do more on the live stream just in a few minutes. Make sure you follow me over there. Go to drtomroselle.com. Some of you have me locked in on your social media platforms. Follow that, and we'll talk a little bit more about this and, try to show you, if you will, what can take place. And I'll show you where the headaches show up on your head, by finger pointing. I'll show you on me. But we have to make sure that we understand the mechanism of what takes place. It's important. You can't just say, hey, put these orthotics on. You can't just go to the orthotic shop and have them do that without fixing everything else. Look, most problems come from neglect, lifestyle, and the unwillingness to change what we have to change to make a difference. And we here at the Roselle Center, if you will, we put the pattern together. We show you what the situation is. We need you as a partner. And by the way, if you want to talk to anyone at the office, just to get a little tidbit, call the office, 703-698-7117. That's 703-698-7117. And tell them, listen, I got this problem. Can I get on the phone with one of your docs for a couple minutes? And they'll have somebody call you back. If you want to send me a note, go to rosellcare.com or simply go to drtomroselle.com and send me a note. And by the way, if you haven't bought your Christmas gifts yet, go to drtomroselle.com, go to the Ageless Health store, and there's tons of stuff there that are really cool to help people with their life, their family, and so forth. Check it out. I think you'll be impressed, and order it. They'll probably get it to you quickly. And, I want you to understand something. This is a holiday season. I love you all, always will. This is why I do the program. You have a great Christmas and a wonderful Hanukkah. I'll see you on live stream right now.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Foot Function and Skeletal Health on Wednesday, January 22nd at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com. Neuromuscular dentistry is more than just teeth and gums. Neuromuscular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live. If you're in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Visit softtouchdentalcare.com or call 703-319-6990.